Please state your name and who you represent. The podium is yours.
Good morning, Mr. Chairman. My name is Fred Birnbaum with the Idaho Freedom Foundation. I'm here to testify in opposition to House Bill 81, meaning that I believe that the legislature should allow the MMRC to sunset on July 123. We originally opposed the creation of this committee in 2019 for several reasons, among those that it wasn't necessary. And we predicted then, and you will see now, it exists for the primary purpose of expanding government. You know the old saying, all roads lead to Rome. Well, all government-created committees lead to the call for more government spending. And I want to go to the particulars of the 2020 MMRC report to point that out. Now, there's only 3 years of data, and I think it's important to keep in mind when you heard these numbers that, the deaths are trending high. When you have roughly 22,000 live births and the deaths, I'm going to read the actual years from the report, page 37, the 2020 report. In 2018, there were about 10. In 2019 was 5, and then 2020 was 11. So you're dealing with small numbers in relation to the total number of live births. And it's important to note that 8 of the 11 women that died in 2020 were already Medicaid participants. So I'm not sure what this committee is going to accomplish. 6 of those were pregnant at the time of death. So they're on Medicaid, most of them, 8 of 11, and they're pregnant. So they're already covered by Medicaid. The contributing factors, and this was a question Representative Blanksma asked, and the report's not clear, but this said that contributing factors, 42% had known or likely mental health issues, 35% substance abuse. So how's the committee going to fix these things? Because as Representative Kingsley said, they're repetitive. It's time to sunset the committee. If you turn to pages 5 and 6 and 25 and 26 of the report, you will see an incredibly long list of things they recommend that really have nothing to do with maternity. Thank you, and I'll stand for some questions.
Are there any questions? Representative Rubel.
Thank you, Mr. Chairman, and thank you, Mr. Birnbaum. I guess I just wanted to probe a little bit. Aren't there things maybe that would be appropriate to do beyond simply adding people to Medicaid? Perhaps it might be appropriate for us to explore whether it was lack of awareness of mental health resources or, lack of access, some other questions that may still be pertinent to look into beyond simply adding these people to Medicaid, since, as you note, many of them already were on Medicaid.
Mr. Birnbaum.
Mr. Chairman, Representative Rubel, thank you for that question. I guess the short answer is I don't think so, and I'll tell you why. The MMRC has issued 3 reports, 18, 19, and 20, and the recommendations are repetitive, A, and B, such a long laundry list. I mean, you don't really need a committee to say some of these things. So, of course, they call for the sunsetting of their own committee. They call for expanding coverage to postpartum. They say facilities, systems, and communities should increase access, education, funding. So, I mean, you really don't need a committee to say very obvious things. They also say that subsidized housing programs should prioritize housing for pregnant women. The state of Idaho should increase funding and support for social services. Systems working on substance abuse disorder should educate law enforcement working with community members. Public health should expand general access to, can't pronounce it, naloxone. And then again, there's a long list. You could just go to probably any website and just download this list. We don't need this committee. It has an added value. And if the existence of the committee helped, and these women are already on Medicaid, why have we not really seen any trend line changes? In fairness, with the small number of deaths and the only 3 years of data, it would be hard to. But Mr. Chairman and good members of this committee, I think it's time to sunset this committee.
Representative Blanksma.
Thank you, Mr. Chairman. If Mr. Birnbaum wouldn't mind, I had a couple questions for him.
Certainly, Mr. Chairman and Representative.
Yep.
Thank you, Mr. Chairman. Mr. Birnbaum, did you say that the committee recommended its own sunsetting? Or they recommended to continue the committee?
Mr. Chairman, Representative, I might have been speaking too quickly. The Idaho legislature should remove the sunset date.
Right.
so that the MMRC can continue. So that was their first recommendation, by the way, that they continue.
Well, I'll soak that in for a moment. Mr. Chairman, another question, Mr. Birnbaum. Do you know, because you've studied up on this far more than I have, I will admit that. Do you know what they're using the federal funds to? Are they, like, where those funds are going? Are they going to generate the report, or are they going to pay the committee, or what are those funds used for?
Mr. Birnbaum.
Mr. Chairman, Representative, I'm just going to speculate based on my knowledge of how these work. Since it's not a lot of money, you have 15 members who are mostly MDs. I believe they're volunteers, but the money is probably for the costs of meeting and preparations of reports. So it's not really about the money. It's really about the value of the committee. And then, of course, as I had said earlier, these committees do one thing. They give political cover to people who ask for even more and more government.
Any other questions? Thank you.
Thank you, Mr. Chairman.